Good afternoon, everybody. Thank you for joining us, and I'd like to thank very much our panelists today, both coming from the GCMEP group, Katie Eustace, who's Managing Director of Answers in CME, and Margarita Velcheva, who's the Manager of Continuing Education for Kennis Group. Thank you both for joining us today and agreeing to talk about this very interesting topic. So I think the topic itself of microlearning, I know when we were having this discussion, and we've had this discussion in the GCMEP group, um, there's a lot of different definitions or challenges maybe about what people consider microlearning. So I think I'd like us to try to talk about what some of these definitions look like. Is there a standard definition? And if so or not, maybe what do your organizations themselves consider microlearning? So, Katie, if you don't mind, I'm going to start with you. What do you see as a standard definition, and how does your organization handle microlearning?
Yeah, so thank you, Celeste. I think it's, microlearning as a whole, as a format, because there is so much terminology surrounding what that actually means, is confusing for people. And, as we were discussing as a group prior to this, many of the accreditors for CME, continuing medical education, don't actually have, formal definitions. So it's left kind of up to us as the educators to define what that actually means. Specifically, yeah, I mean, some of the things that come up when I think about microlearning in conversation with other organizations or in the industry as a whole, it's referred to as micro or bite-sized, micro courses, just enough information, this type of terminology or framework. I think for my organization and the way that we define it, I'll go kind of a step back and say, what it's not. And I think, microlearning is not chunking out, lots of information or lots of content that you've created and kind of like chunking that out into bite-sized pieces. Microlearning for me or for my organization, what that actually means is developing the content from the beginning to the, to achieve what you're trying to accomplish. And, my organization defines microlearning as about 15 minutes of content consumption. And we develop that content backwards forwards, meaning that we develop, what are we trying to achieve in terms of the learning objective? What level of outcomes are we trying to achieve? And we develop from there and then create the content. So yeah, I
And
mean,
that's how we do
a
it.
lack of, definition is definitely confusing for people.
For a lot of people. Yeah, and you used quite a few different terms there. And we even
Exactly.
saw that in some of the questions come up. People were calling it micro learning, bite-sized learning, nuggets, those types of things. Thanks, Katie. Margarita, why don't you tell us about what you've seen as far as micro learning, and how does your organization define micro learning?
Thank you, Celeste, first of all, for the invite and for being here. So similar, echoing what Katie's saying, absolutely, the definitions out there are various. Different organizations define microlearning in a very different way. Definitions matters when we need to understand something and apply it, especially, again, looking into the need of our learners.
Mhm.
We tend to follow similar approach to Katie's organization. However, sometimes we also decide that creating smaller bits or nuggets or chunks of information then helps with the content we're trying to develop. And then focusing on a particular topic or a skill, and then creating that micro content around the topic. Yeah. In terms of accreditors definition, we checking what's available, refreshing our memory. Accreditors also define that in a different way. Some consider microlearning as a 30-minute content. we often tend to focus on microlearning as between 5 to maximum of 15 minutes of education. So it varies quite a lot.
Yeah, it varies. Yeah, and I think that that's important to define that there doesn't seem to be consistency on this. And to your point, so I think what you're saying is you do develop some content specifically to be by micro learning, but there's also other content you take that may be a larger overall piece and put that into bite-size chunks, or what some people might consider micro learning. So you kind of handle it situationally a little bit differently depending on your situation.
Exactly.
You mentioned accreditors, and I think that's something that comes up a lot is, is micro learning accreditable to begin with? And if so, how do you do it? Do you do it? Again, what about accreditation? So Margarita, I'll start with you on this one. How do you handle the accreditation piece for micro learning?
Particularly when it comes to accreditation, we do not accredit our microlearning formats. We certainly see value when we speak about accreditation. There is a quality stamp, but particularly for that format, because our organization develops various education with various formats. So we don't see the necessity to accredit particularly microlearning. Because learners can receive accreditation from different formats, or sometimes we also see the challenge with accreditation rules on microlearning. That's adds sort of difficulty to decide how exactly we should group content so it matches the requirements and so on. So to your question, no, we don't.
You don't accredit microlearning. Katie, I believe you do a bit differently, though. You do accredit microlearning.
Yes, correct. We do. And, I think this goes back to, so microlearning CME based programs are rigorous, learning activities, and they meet accreditation standards depending on how they're developed. Again, going back to that point. So if you are developing your content with a learning objective and using the Moore scale, a level of outcomes that you're trying to achieve, that is attainable and achievable in a microlearning activity. So yeah, a majority of our microlearning activities are accredited. I think that in the European CME accreditation formats that we currently, or organizations that we currently have available, that we are met with some challenges in terms of how to do that and how to apply that. I think the ACCME obviously is a bit more evolved in terms of, offering the, 0.25 credits. And I think, EBAC has also recently, within the last year, evolved their understanding and application of microlearning to allow European accreditors to accredit with that as well.
Yeah. Is there anything from an accreditation standpoint that either of you would like to potentially see, or could help make it a little bit interesting? I think, Margarita, from what you're saying, if I understand this correctly, you're not going through, even though the content is potentially accreditable that you're doing, you're not seeking that individual credit for that piece because maybe because it doesn't quite fit into the European standards. Is that it? Or from a time perspective, or that maybe trying to get people to evaluate those types of things. I think that's kind of what you're saying. Katie, I know that you tend to use the American credit because that is a bit more formalized. EBAC, to your point now, is doing more so, that ability. Is there anything that either of you would like to see the the credit systems, the accreditation systems evolve to make it, I guess, a bit simpler for physicians or healthcare professionals to obtain that credit. Because I think, if we go to why are people so interested in microlearning? It's a time issue. So if it's a time issue, is accreditation slowing that down a bit, or there's some things that could help in that perspective? Margarita, anything from you, off at this point in time, the top of your head that you might think could be helpful?
Sure, Celeste. So to your point, we do absolutely, when we develop content, we follow the guiding principles. So the fact that the content is not accredited doesn't mean that we have not followed, the steps.
Right.
And I would say the biggest challenge is really time. I'm not saying it's not, it's possible to create microlearning with the current within the current European environment. So you can combine different different microlearning formats, options, and then you can accredit that. But if the systems were a little bit more flexible, then we would also have more opportunities, because we have to manage in the systems of how to track. So the system is very much based on time, and this is where the challenge comes from.
Yeah. Katie, I see you nodding. Your thoughts on this?
Yeah, I agree. I mean, the time that is the challenge. And so if we could, see accreditors evolve in a way or a manner that that was more, aligning with healthcare provider needs, then I think that this would be a step in the right direction for sure.
Yeah. And I do think that we're seeing, the European accreditors in particular seeking out different ways to evolve their accreditation to ensure that they're accrediting good content for, for healthcare professionals. So we've talked about, what is microlearning? We've talked about, the whole accreditation aspect, but, we see in studies and surveys over and over again that this is what healthcare professionals want. They want, they're time pressed, time poor. They want micro bite-sized people. We see people utilizing social media for education, especially the generation of physicians that are coming into practice now who kind of grew up with social media and TikTok and all of these other type of aspects. But obviously, there's a lot of benefits to microlearning. There's also drawbacks. Katie, would you like to expand upon what you see as benefits from microlearning, but also if you see any drawbacks there? What are your thoughts there?
Yeah, I mean, obviously, I think, microlearning has been a game changer in terms of, consumption of CME or independent medical education. I mean, I think, technology is kind of changing the way that, everyone is consuming information. I mean, if you think about yourself, or if I think about myself, and the way that I consume information or how I learn, again, it's short, it's quick, because that's the time that I have to allocate for it. And so why should we think any differently for, healthcare professionals? I think, some of the positives, which we've touched on a bit, but some of the positives are really that, the availability and the accessibility of microlearning. Healthcare providers are extremely busy. Let's create the content that we believe that we've, identified a need for, to be able to be consumed in their busy schedules. I think it's flexible, it's on the go. Some of the other things about microlearning that I think are important is that they can be, context rich. They can also, assess in terms of Moore's level or simply evaluation. And you can also personalize the experience for the learner. So I think these are all some of the positives to microlearning. in terms of your the second part of your question, maybe I will put that over to Margarita, because I actually see very positives.
Yeah.
I see mostly positive for
Yeah.
microlearning. So
Yeah. Margarita, pros, cons, are there any drawbacks to Katie's point? Is this, are there any drawbacks to to doing micro learning?
Yes, we do. I mean, I can comment on what we experienced while developing microlearning. And thank you, Katie, for summarizing the positive. I mean, there is obviously a huge lead there, and you've done a fantastic job to mention, the most important points. The drawbacks that we see when developing microlearning content is that we tend to spend a little bit more time on developing microlearning than compared to other formats. Just because the content has to be really tailored, and it's not exactly, Katie, as you said, it's not just taking information and summarizing it. It's really focusing it on the right objective, the outcome, what you mentioned, the backward planning, and sometimes I remember this was also mentioned in a book. Give me more time and I will make a better summary. So definitely this is something that we see. We don't always have the capacity. Sometimes we have to go in faster mode. So this comes as a huge challenge for us.
Yeah.
Also working with medical professionals who are extremely busy.
Yeah. I would say that that could potentially be, an issue, because I think some of our faculty, unless they have been exposed to working with micro learning content, that could be a bit of a challenge. There is getting them to be able to focus on how do we get this one, this 15-minute or maybe even 5-minute, piece of education out there, when they're used to maybe doing an hour-long presentation for something. So I think that potentially, and what I'm hearing from both of you is I think a lot of people think micro learning, it's smaller, it should be easier, it should be faster to create. But I think what you're both saying is that the smaller the piece of learning, the more complex it is to create good quality education. Is that?
yeah, I completely agree, Celeste. I think I'll give a shout out to the medical writers and the chief medical officer at my organization, and the medical directors that I have the pleasure of working with. They will always tell you that it is definitely more challenging to do it this way than it is to create an hour-long presentation, because you can't cover the kitchen sink. You have to be very succinct and very thoughtful in what you are trying to accomplish. So
Yeah. Margarita, I see you shaking your head. You're in agreement. It's not that easy to create it. You have to really think about this when you're doing it
Absolutely.
well. Yeah.
Absolutely. And I just wanted to mention, a new type of, let's say, format of microlearning that we just recently sort of started testing out, an infographic. So that, it doesn't always have to be a video, of course, it depends, right? But we realize, especially for developing infographic, how much more time we need to just create like a one-pager, a summary of what was discussed.
Yeah, that's very true. So you bring up the of format, and I think that a lot of people kind of assume micro learning first thought is video, because we see a lot of video. We're all used to it in our everyday lives as to what we're consuming. But you just brought up another point, Margarita. So besides video, what other types of formats do you think lend themselves well to micro learning pieces?
So what I just mentioned, we tried to focus on infographics, something very visual, to help assist the learning. Then we we started focusing a little bit more on social media as well. I think Katie mentioned that in the beginning. So, for example, sharing information on WhatsApp groups, and that has then a better reach. These are basically the formats that we within microlearning that we use currently in our organization.
Yeah. Katie, what are your thoughts besides video? What other formats lend themselves well to microlearning? And I'm going to put a little further. Can you do microlearning in a live setting even? Is it possible, or maybe hard to measure?
I do think it's possible. We all have to get creative, right? I think one of the formats which I think works really well in a microlearning format is like a clinical decision making scenario, or applying something to practice, applying a skill or a practical application. However you do that, whether you have, a series of questions, or you have diagnosis, and then you're going on to treatment, however you're, developing your content, what you're trying to achieve. I think that those work really well in a microlearning setting. And as you mentioned, Celeste, as we previously spoke prior to this webinar, think about clinical decision making in practice. It's not that these healthcare providers have, an hour to do this. They're seeing, multiple patients within an hour, and those decisions have to be very quick. So microlearning is no different than that.
Yeah.
So.
Yeah. Very, very, very true. We've talked about, planning the content and planning with the end in mind, so to speak, but we haven't really touched strongly on learning objectives. And I have some thoughts and questions, about this. Katie, when you're doing a piece of learning objective, how important are a piece of content? How important are those learning objectives? Is there a certain number that you look for? How do you do this? We talk about Moore's levels. How far can you measure with something like a piece of learning of micro learning?
Yes, so the objectives are obviously very important, and the objectives need to be limited in microlearning. So again, going back to my comment of the kitchen sink, you can't cover everything in a short format. So you really need to think about what it is that you're trying to achieve, and base the learning objectives or objective on that particular situation, or learning pearl, for lack of a better word.
Yeah.
So
Yeah.
and in terms of measuring outcomes, if we're talking about Moore's level, yes, I do think that you can achieve a higher level outcome on microlearning. It all depends on, mapping your learning objective back to the questions that you're asking the participants to respond to, and how those are developed. And how those are asked. And yes, you can reach, level 4, and then however you might want to achieve level 5, however, different organizations do that, that's also achievable.
Yeah, because that is one of the questions that did come in about, how do you measure? How do you measure? Because thinking historically to larger programs, sometimes those outcomes measurements are quite in depth, and search for a lot of different information, and potentially report on multiple learning objectives and items like that. But how do you still get meaningful outcomes, and what level when you're doing a micro learning piece? Margarita, how do you handle the measurement portion of this? Because even if you're not accrediting, I know you're measuring, because you have to, figure out, was this successful? Do we still need more education in this area? How do you go about it?
So thanks, Celeste. Similar to what Katie's saying, it's very important, when you identify your the need, again, narrowing it down to really what's important, and then focusing on that backward design planning, having not 5 learning objectives, you know, maybe 1, maybe 2, really focusing on the area, creating that really focused and clear objective that is linked to the outcome. And then having questions to support that at the end and checking. So yeah, just a very, I mean, it's something that we discuss a lot within the Good CME practice group as well. And the steps that we follow.
Yeah. And Katie, I think we had you and I've had this discussion back and forth. Can we get past level 3 realistically in a 15-minute piece? And you contend that yes, we can get to level 4. How do you go about doing that? How do you go about measuring and getting a level 4 outcome out of a 15-minute or less piece of learning?
That's how you're developing your question. I think that would be my initial point. So if you're trying to accomplish, get above knowledge and go to competency, like in terms of like self-reported, I mean, that is all in the framework of the question that you're trying to achieve, right? So that would be my answer. It's all in the details. The devil is in the details.
Yeah. I'm going to ask just a quick question, kind of a yes or no, because we had a very, very brief discussion about that. But has anyone here ever incorporated patient or patient voice in their micro-learning piece? Margarita, have you ever done that? To this date? Okay, not yet.
To this date, no.
To this date, no. Katie, what about you? Have you done that yet to this date?
Yes, we have, and we do. And I think that comes in very nicely when you're talking about, quality of life or experience with adverse events. I think that's the place where the patient voice can really lend itself to microlearning or education as a whole. I think another way of integrating the patient voice is really when we're talking about applying skills within a microlearning piece, where we talk about patient-facing, like, soft skills that physicians need as well. I mean, I think that's something that we forget, but there are communication strategies that will go over better with patients, and I think that that's something that we forget. And I think microlearning can do a really nice job of doing that, of communicating that.
Well, ladies, we could talk about this for quite a while, but I do realize that we're running short on time. So I'm going to each give you 1 minute and ask you for one piece of advice that you would like to leave with our audience today on microlearning. Margarita, I will start with you. What's the one thing that you'd like to tell the group today so that they can go off and feel a little more confident in their microlearning settings?
I would really like to emphasize on what we mentioned throughout the discussion on the learning objective. Really focus. That's a very, very important aspect. Focus on a clear learning objective, and when you have a precise goal, then you will help your learner to really focus on that content and stay there and make it more relevant than it is. And yeah, good luck with developing microlearning activities.
Great. Katie, what would you like to leave our audience with today?
Well, Margarita stole my nugget, but no, I mean, to echo what she's saying, it's, microlearning is, something that, again, has to be developed with clear thought and focus and clear objectives, and you cannot cover everything. So I think if we remember that, I mean, if you're trying to cover a broad spectrum of content, maybe consider that microlearning might not be the right format for that. I mean, just because microlearning is the buzzword and doesn't mean that it's a one size fits all. I think we have to be thoughtful in the process of developing, and what we're trying to achieve in the content. And the kind of the second thing that I would say is, in favor of microlearning, again, is that the world is changing. I think about the way that I consume content. And I think, on one hand, the time is over for 1.5, 2 hour, 3 hour presentations, particularly online when we're all fatigued. I think we have to think about and respect the time of individuals, healthcare providers, just like we would wish that somebody would do that for us. And so if we want to achieve something and accomplish something, we need to think about that and the time that it takes.
Great. Well, thank you both very much today for sharing your wisdom in this area, and thank you to our audience for joining us today. I hope you'll find this helps today. I hope you'll find this helpful. Thank you all, and have a good day.
Thank you.
Thank you.